Continuing on with the anatomy of the respiratory system, we are going to focus in this PowerPoint on different muscles required for inspiration and expiration. So, primary muscle of inspiration, diaphragm, absolutely the workhorse of inspiration. You can see it here. It's this dome-like muscle that's located below your lungs, okay? And this is the motion that it makes. You can kind of see in this animation. This is another diagram that's going to show you the diaphragm placement, okay? And it specifically kind of shows the difference between breathing in and breathing out. So again, major muscle, primary muscle of inhalation is the diaphragm. So when you breathe in, it's going to contract down. So your diaphragm contracts, like when you think about flexing a muscle, contracting a muscle, it's going to move down. And when it does that, its goal is to really open up and enlarge that thoracic cavity. And we're going to talk about why it's important to enlarge your thoracic cavity on inhalation a little bit more when we talk about pressure differences. But for right now, really kind of understanding when you're breathing in, your ribs and your muscles are moving in a way to enlarge that cavity. So your diaphragm is going to contract down, enlarging your thoracic cavity. Air is going to flow in. And then conversely, when you breathe out, your diaphragm will passively relax. Okay, so it's contracting on inhalation. It's going to passively relax, moving back into its original position, this dome-like muscle here. And if you notice, the thoracic cavity is now much smaller and air has moved out. Okay, so on inhalation, your diaphragm contracts down, making the thoracic cavity larger. On exhalation, it's going to relax back up into its position, and your thoracic cavity is going to be smaller. Different diagram, same thing, okay? So there's the diaphragm again. It's going to contract or move down to enlarge the thoracic cavity. This also shows you those rib motions moving up to enlarge the thoracic cavity. This brings air in. And then on exhalation, that diaphragm is going to relax, move back up. And again, those ribs are going to move down. And this just, again, shows that thoracic cavity getting smaller, and then the air is exhaled out. You guys don't have to know a lot about different innervations. I just really want to highlight the phrenic nerve, which is shown in this diagram here. So you have your right phrenic nerve and your left phrenic nerve. And just a little reminder, when you're looking at something from an AP perspective, the right is on the opposite side, so just kind of familiarize yourself with that. I know in survey you guys look at x-rays and talk about this, but just so that you guys can kind of remind yourself, because sometimes that can be confusing. So your right phrenic nerve comes down here, controls that side of the diaphragm. Your left phrenic nerve travels down here, controls this side of the diaphragm. So you can't really see it in the previous slides, but your diaphragm has two hemispheres. It's kind of separated in the middle. So you have your right side and your left side of your diaphragm, and they're controlled independently by these two nerves that are located up high on the neck. The reason, especially as respiratory therapists, that we care about the phrenic nerve is if somebody has a spinal cord injury or if somebody has nerve damage specifically to this nerve, it can paralyze the left or right side of the diaphragm, or it can paralyze the entire diaphragm. When that happens, a person's ability to inhale properly or to ventilate properly is severely compromised. This muscle is huge. It really does a lot of the main work for breathing in. And so if that is paralyzed even partially, it can really affect a patient's lung capacity and ability to breathe effectively. So that is why we care about that particular innervation. This is a video about a gentleman who had some phrenic nerve damage. I highly recommend that you watch it. He ends up getting a graft, and they kind of discuss the differences before and after. The other primary muscle for inhalation is your external intercostals. Okay, so this is kind of a confusing point. Your diaphragm is a primary muscle, so are your external intercostals. If you're comparing the two, just size-wise, your diaphragm is obviously going to be much more of the workhorse for your inhalation. Your external intercostals, although a primary muscle for inhalation, they're not responsible percentage-wise for quite as much as your diaphragm. So this just kind of shows you where those external intercostals are located. And again, kind of refreshing your memory, going back to those intercostal spaces. These are muscles that line your ribs, and they're going to pull them up and out during inhalation. Okay, and you can kind of see how that would work given their location. So if you think back to that bucket handle and that pump handle, these are muscles that are going to be responsible for lifting your ribs up and out. Again, really trying to increase the volume of your thoracic cavity when you're breathing in. Okay, so you have two primary muscles that we're going to be talking about for inhalation. You have your diaphragm, which is your major muscle, and then you have your external intercostals. Okay, two primary muscles, inhalation: diaphragm, external intercostals. Your primary muscle for exhalation is your internal intercostals. Okay, so these again are your external intercostals. These are your internal intercostals. And if you think about where they're located, you can tell that they're more on the central side here. And these are the muscles that are going to be pulling your ribs back in. So these external intercostals will be lifting your ribs up and out. Your internal intercostals will be kind of bringing them back down and in for exhalation. So opposite movements, opposite muscles. And I know that's kind of tricky given the similarity in their names. So I tried to highlight exhalation, inhalation, just really kind of pay attention to that when you're looking through and you're studying. So this is another way to do it. Your primary muscles of respiration. So primary muscles of inspiration are your external intercostals, your diaphragm. Your primary muscles of expiration are your internal intercostals. Diaphragm is listed here, and I almost put a box over it just because I really don't want you to get confused. The diaphragm is absolutely the primary muscle of inspiration. I personally wouldn't have put it over in the muscles of expiration because to expire, all it does is relax back into its original position passively. So it's not really engaging to exhale. It just kind of relaxes back into its original position. So just really kind of hone in on the fact that these two are the primary muscles of inspiration, and we're just going to worry about the internal intercostals for the muscles of expiration. I just kind of liked this diagram as a way to chunk it up. So we talked about primary muscles. There's another category of muscles that they call accessory muscles. So accessory muscles are muscles that you use during active breathing. So if you want to think about active breathing as when you're running and you're out of breath, think about the way that your breathing changes and the muscles that you can see when you're breathing that way versus when you're quiet breathing. And I highly recommend looking in the mirror after this PowerPoint and just doing your normal breathing, your quiet breathing, and you can see the way your ribs move and you can see the way that your chest expands. And then try to do some active breathing where you try to mimic being out of breath or do a couple jumping jacks or whatever you need to do to create active breathing. And you'll notice all of these different muscles that you couldn't see before that you can now see. There's a muscle that goes in your neck called the sternocleidomastoid because it needs to be the longest name ever. But it is a muscle that you can see flexing in the neck when you're active breathing. Your scalenes group, which are also muscles in the neck, they're the smaller muscles kind of behind that sternocleidomastoid right here. And then it doesn't show it in this diagram, but your pectoralis major and minor are also accessory muscle uses. So you can see your pecs moving when you're trying to do active breathing. Your trapezius move when you're trying to do active breathing. Again, that's not featured here. But the reason that we care about accessory muscles is when you get patients that come in that you are treating, and let's say they're having an acute situation where their work of breathing is very, very high due to, let's say, COPD or an asthma attack or something of that nature, when you're watching them breathe, they're using all of these different muscle groups that you don't normally have to use to breathe. And that's a really big warning sign for us. The other reason that we care about accessory muscle usage is muscles consume oxygen and put off CO2. That's how you consider your metabolic process. If you are using more muscle groups to breathe, you're making your ventilation more inefficient, essentially, because you're having to give oxygen to all of these extra muscles to move your ribs up and down and bring air in and out. Whereas normally you should just be doing your diaphragm movement and your intercostal movements. Now all of a sudden you're adding all these other muscle groups to try to move your ribs up and down to create that same motion. And it's an inefficient way to breathe. You're going to require more oxygen. So this is not something that you want to be doing if you're somebody who's already compromised by a disease process. And we'll obviously kind of go into more and more different things that can create problems with ventilation. But those are just the basic muscles that you guys need to know for right now. This shows the different muscles in an animation. You guys can watch that on your own. But I sometimes like the 3D version of diagrams so you can really see how they all interplay together. So that's why I try to include those in these anatomy PowerPoints. Again, we're going to have these lecture questions at the end of every PowerPoint. You guys are responsible for answering these and turning them in. You guys can refer to the calendar to see when they're due. But just kind of going through what is the primary muscle of inspiration. When you inhale, your diaphragm moves. I'm sorry, when you inhale, your diaphragm, and I'll just tell you this one, contracts, which is enlarging the chest cavity. So kind of going through and answering these questions. And just know that if I'm putting these questions at the end of a PowerPoint, these are definitely the areas that I want to highlight and are more than likely going to become a version of an exam question. So take your time. These ones, again, the anatomy ones are much, much more straightforward. These are really great for flashcards. When we get into some of the more concept-heavy PowerPoints, it's going to become more of a define, explain, describe, and then those ones really, really kind of hunker down and make sure that you're understanding the material. That is it for this one.